This is Dr. Meyer, physician in Sacramento, California. This past few weeks been talking about your personal physician, choosing a personal physician, getting a physician that will work with you. Today I'd like to turn the tables of when doctors are the problems. There was an article, cover story in Parade magazine some time ago about your doctors may be hazardous to your health. It stated that when Dr. Ted Lewis, was a kidney specialist, was asked how many of the nation's 650,000 doctors could be categorized as incompetent, unscrupulous, or impaired, he says very few, probably less than 5 or 10%. But even that would suggest that could be up to 65,000 physicians who could pose a significant risk to you. Unfortunately, that's not just a few. In an attempt to identify bad doctors, the physician organization set up what is known as peer review, where doctors review doctors. This means that in a given field, the work of doctors is reviewed by other doctors in the same field. They thought this would be a very objective way of doing this. They forgot about the economic aspects, that maybe this was an easy way of getting rid of competition also. But anyway, a lot of doctors lost their license, and then of course if you lose your license, you're reviewed by the medical data bank, and if you ever get into that, that's considered a tomb. Doctors will never practice after they get listed in that bank. So somebody decided then maybe we ought to take a look at these charts at a different perspective. Let's take these same charts and give them to doctors in a different healthcare environment, a different hospital, totally unknown. Surprise, they found that 70% of these doctors that were listed as bad doctors were actually doing quite well in other doctors' estimations. And so they said, well, this maybe needs further research. So what they did then is take charts of the original doctors that had reviewed the bad doctors and studied they were bad, and see how they were doing. They found that these doctors had even a higher rate of bad judgment, poor care, and some of them even caused death. When this was brought out to the attention of the hospital administration, they were pretty well covered up, because the doctors that were reviewing were also very high in the hospital administrative hierarchy, and they were very important in keeping the finance of the hospital going, patients coming in, and keeping things moving. So nothing ever became of that. Even if the patient died and reported to the medical board, the doctors just said, well, we looked at it and there's nothing else that important, and everything is fine again. So you have to be very careful, and some of the review on how good your doctor is, you have to do yourself. You have to keep your eyes open, look at things logically. Don't let your doctor move too fast. If he says something that seems a bit unusual, just go home and think about it, and if you can't resolve it, then maybe ask for another opinion, because the peer review has turned out to be a abusive peer review. In fact, there are probably 3 or 4 articles written on abusive peer review every month now, because this has gotten to be of epidemic proportions. Doctors found out they had a legal way of getting rid of their competition, and so this is very circumspect now, and so be very careful and be involved in looking at the quality of your own physician. That's it for this week, and we look forward to talking to you again next week.